we operate, as you know, the Regional Children's Center, and that's where we're going to have our social worker come from. We see over 2,000 youth and children come through our program as young as 6 years of age, with very challenging circumstances. We actually repurposed one of our programs about a year ago, and we went from a small residential program to now an at-home program. We have outreach teams that visit families at home to provide support. So we see it day in and day out. This added resource will keep people at home where they belong. It'll support the families as well, and I can't underscore the importance of that piece as well. It's a focus on youth and children and youth, right? But obviously there are parents who would need some supports, and there would be referrals involved. You know, with the social worker and the police there, they have a network of referrals that they could trigger. We can get them into the RCC, we can work with Maryville, we can work with Children First. If necessary, we would bring them to the ER if it's an urgent and a pressing matter. So this is really valuable because it keeps them out of the institutions, it keeps them out of the hospital beds, it keeps them at home with some supports. And based on our experience that we see at the RCC, you know, 365 days a year, this would be a very value-added resource that will work both ways.
These teams have moved the needles for us. They're delivering services that we just didn't have in that real-time piece. So the model is working. In fact, this model is being mirrored in other communities, which we're so proud of. This is a made in Windsor solution that we are so proud of, and see how well it works to the point of the government realizing the significance of the program. So that's really the success of the other models. This is a very easy step towards that because it works.